Up next on Q100.7 FM, the Pulse Radio Show with the QEH team, brought to you with the compliments of MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Pleasant good morning to listeners of Q100.7 FM, CBC's favorite station, for another edition of the Pulse Radio Show, a production of the Queen Elizabeth Hospital. I'm Shane Seeley. Always good to be with you on a Monday morning from 11 to 12 we go, sharing all of the information you need, and of course answering your questions as well, getting your feedback on our services at the Queen Elizabeth Hospital. We love to hear from you. And of course, we had a number of officials coming in from Ghana on that flight. One of them, the Deputy Minister of Health, Adelaide Ntim. Her country is doing some awesome work providing us with nurses. This is the third cohort, the third set of Ghanaian nurses to come and help us as the world experiences a crisis and a shortage as far as nurses are concerned. So Ghana lending us a helping hand, a lot of cooperation between us and that West African nation as we try to enhance what we do here at the hospital, across our polyclinics and the healthcare system in general. Speaking about this on the occasion as we welcome the nurses and to welcome them there at the Grantley Adams International Airport in the Grace Adams Suite was our Minister of Health and Wellness, Senator Dr. the Most Honorable Jerome Walcott. Here's what he had to say about that.
We have nurses going to the QEH for the various specific specialties, accident and emergency theatre, cardiac trained nurses, and other areas. In the case of the Ministry of Health, we were concerned about nurses, midwives, certainly in the area of psychiatry with the focus on mental health. We have a number of nurses who are trained psychiatric nurses, and this was an area where we were suffering for a dearth of trained psychiatric nurses in Barbados. We have nurses also who will be working in the polyclinics deployed in primary health. I gather that we have some nurse practitioners in this group who are here. So we're looking for these nurses to help to improve the overall delivery of our health care.
And a number of senior Ghanaian officials also coming in on that flight to share on this great occasion. It's all about collaboration, and really the Ghanaian nurses have become a part of our Barbadian family over the past few years. A number of them have stayed with us, not only at the hospital, but they have families here now. So it's good always to have some new members of the family now coming into us. Representing Ghana was the Deputy Minister of Health, Adelaide Ntim, and she says the African country is pleased to continue to send nurses to Barbados.
We have so many nurses available who are not even working. So for you to come and employ some of the people, I think is very incredible. And I believe that whilst they are here, they are able to deliver. Because I know they have the experience to work. And like you said, you have employed previously, and they are doing well. So I believe everything is going to come out well.
Adelaide and Tim. She is the Deputy Minister of Health coming in from Ghana, speaking to us from the Grantley Adams International Airport yesterday on the arrival of those 155 nurses. And we'll speak about more of our specialist nurses here on the Pulse Radio Show this morning. Remember, you can call us with your questions or comments at 4341007 and 4341070. You can also WhatsApp us at 4341007. Your feedback is critical for the enhancement of our services. Now, let me welcome on today's radio show. Many of you may have seen the flyer gone out. Dr. Greenidge, our Chief Operations Officer, can't be here with us today, but we do have Dr. the Most Honorable Corey Forde, a COVID-19 champion and our Director of Clinical and Diagnostic Services. He's sharing today on, as we continue that discussion, on the new strategy for the QEH, the new way forward for the QEH. It's called the QEH 2025 to 2028 strategy. And Dr. Forde's directorate is a very important cog in the wheel as we move forward to enhance services at the QEH. He covers a number of critical spaces. Of course, one of them is our pharmacy, which in that is the medication delivery services. Medication delivery service, one of our great success stories in this 60th anniversary year. It would have started during COVID as a means of continuing to get medication to the public while decanting the hospital, while making sure that the hospital is not congested during that period. It continued and it has become very successful. Today we had some 140 plus packages to be delivered to patients who would need their medication. So our team there, we really want to salute the pharmacy team who have been working very, very hard. But again, welcome Dr. Forde. Welcome back, I should say. Your first appearance for season 2. And you have been busy. You've been seeing all of the activity happening at the QEH. First, you would have been there when we got the first cohort of Ghanaian nurses.
Oh, for sure. And they paid good morning to all listeners. And I hope everyone is well, enthused and ready to go on a bright early Monday morning. A little bit of rain sprinkling outside. Yes,
showers of blessing.
Indeed. I certainly was on the ground with the first set, and they played a major role in our COVID pandemic response, and I think that's never to be forgotten, certainly by our country. I'm really here today, as you know, to give the public really to continue on the discussion in terms of improvement in service delivery, in terms of the plans over the next few years, looking at service delivery, looking at workforce, looking at infrastructure, hospital finance and procurement, and information management and technology. But I'm gonna use that kind of focus to kind of circle in some of the areas so that people know, the sort of things, some of the heavy areas that may have responsibility for. You mentioned before pharmacy. You'll talk about that a bit later. Diagnostic capacity in terms of laboratory services, and X-ray, CT services, etc. And I'll give you a little bit of update on that and our projections and way forward. And when you compare Barbados certainly to many countries, we are building as time is going along. But in this particular plan strategy, 2025 onwards, we will expect to see a lot of changes, a lot of improvements in our systems. At first, I just want to start off by thanking every single person within the directorate. So talking about the pharmacy, you're talking about the radiology department, to an extent the therapeutic component of the oncology department, to central sterilization, to my own group, major group in infection prevention control, and of course the laboratory services as well, and dietary services, which has been added to my directorate, to my director as well. And I believe that these embedded in this group of individuals are champions. And sometimes we hear about doctors and we hear about nurses, but these are really some of the unsung heroes, especially in the laboratory, pharmacy, and diagnostic section in the hospital. These are some of the departments have some of the hidden heroes. And as we look to improve things over that period, as we just discussed before, one of the things we look at in terms of diagnostic services, and we talk about the laboratory specifically, we really have to try, and we're going to try over the next few years to improve turnaround times in terms of laboratory services, to improve turnaround times, and I'll talk more about these in a little bit of detail. In terms of diagnostics, we've done some heavy work in the pharmacy, and there's much more to go. And then we'll talk about infection prevention control and a little known department which is called central sterilization and disinfection, which doesn't only provide for the QEH, but really provides for many other external parties to QEH,
better known as CSSD.
Central Sterilization, Central Sterilization Department is there. So as I said before, there are many hidden heroes, and the dietary department, which is something that dietary services, which are nutrition services, which is very, very important in a hospital, but it's also important that people know what they should be taking and what they should be using, both as in and out patients. And they have really expanded over the last few years in terms of what they do with in the terms of a resource constraint setting. So I'm just gonna, if you allow me to, give an idea of some of what we would like to do in the next few years. It's not going to be easy, but I think it's also component by the fact that we've gotten or are going to get a new branch of staff. I heard that discussed on the previous program. Some are for me. I hope more was going to be for me, but we'll have to wait and see what happens. But if you talk about the laboratory, for example, the laboratory is very widespread. And you're taking laboratory tests. Average patient goes, takes laboratory tests, or the doctor takes the blood from the patient, and it just disappears, and the doctor comes back with a piece of paper or on their phone, and they make a decision. And that's a process that most Barbadians might not even understand what goes into that. How are we going to look to improve that over time? I think one of the things which we're doing shortly, before 2025, we're really going to do is try to pilot something, Shane, which is try to move away from a paper-based system. You know how I hate paper, right? So to move away from a paper-based system and to go kind of electronic. And I think it's going to fit very much well in with the health information system which will come in place. So we're going to pilot something in the emergency department, which will allow us doctors to order online, and you'll hear more about that shortly into early next year. With the order online, we already have the technology to do that. They can order online. That information is printed downstairs. So the doctor is writing on a bottle to be printed, and it can be scanned upstairs in the laboratory, and that goes into our system. What I would say is that what most Barbadians don't know is that laboratory, for most part, except for one part, which I'm going to talk about next, is very well automated. The results go in the machine, they cycle, and they produces right. So we're trying to find ways of cutting down, having someone, for example, have to write in a bottle, walk something upstairs, write in a piece of paper, get it upstairs and get it processed and get it done.
As you say, moving from that manual process to a more automatic digital movement, which allows for speedier results, speedier transactions, and of course reducing patient wait time at our hospital. Before you get into that other section, we have a special health forum coming up, and these nurses are very well connected to you, Dr. Forde. You work with them all of the time. We have a diabetes health forum that will be on the 6th of November, and this one is for everyone, the public. So this Diabetes Health Forum will be on the 6th of November at our QEH auditorium. We start at 6 p.m. sharp. So you have that chance to hear from our experts, Dr. Dawn Scantlebury. She's a consultant cardiologist and head of the cardiology department. We also will hear from Dr. Danielle Doughton. She's a senior registrar. She is in nephrology. Consultant endocrinologist Dr. Mike Krimholtz. He will also be there. You may have seen him on Morning Barbados this morning speaking about the forum, and alongside him Dr. Charles Pierce, a consultant ophthalmologist, and he really focuses on how diabetes, this chronic disease, affects the eye. Pulling all of this together, I must really thank one of our specialist diabetes nurses, Deborah Knight, who is actually on the phone line. We'll spend a few minutes with her to hear a bit more about the forum, why it's so important for the public to come and get that information. And really, it's all a part of our 60th anniversary celebrations as we continue or give back to the public. We get our experts face to face with those, especially the individuals, those patients who are living with diabetes, and we really want to help them have a better lifestyle, help promote a better lifestyle even with these chronic diseases. And hopefully, I know a lot of people don't like to be on medication. They like to do everything to get off of the medication, but it's all about diet and exercise. And I know that Nurse Knight will tell us a bit more. Nurse Knight, good to have you on the Pulse Radio Show. Talk to us about this forum. Why did you decide to put it together? I know it's a part of our fringe events as we celebrate our 60th anniversary, but why was it so important for you to create this forum for the public at our QEH auditorium on Wednesday at 6 p.m.?
Good morning, ladies and gentlemen. Good morning, Shane. It's important because I work daily with persons who have challenges with diabetes, and from my interaction with the patient, their challenge would always be, nurse, what to eat? Nurse, I don't have a clue how to manage this condition that is ravaging me. And most of them will use the term, I'm suffering from diabetes instead of managing. And as I look across the hospital, you see so many patients in these specialist clinics for kidney failure, heart failure, and of course diabetes clinic. And when I really took a closer look at it, I found that if we could get all of these specialists in one place and get the public to ask questions that can help them live a better life, that's why I conceptualized this forum on the 6th of November. And I'm hoping that the Barbadian public will come out and really ask the hard questions, how we can best manage this condition holistically. And that is why I think this forum is very, very important.
You got cardiology represented, Dr. Krimholz, of course, he is a former head of medicine, Dr. Dottin in nephrology, and Dr. Pierce in ophthalmology. So you're really covering a wide range of areas where diabetes can affect your eyes, they can affect your heart, etc., etc. How many people are we catering for? And I want to ask you too to give Barbadians a picture of how many people you're seeing in your clinic on a daily basis, and are you seeing those increasing numbers as suggested by the chronic disease crisis that is affecting Barbados?
Oh, the QEH auditorium can go up to 200 persons, and we would like to fill the auditorium. But on a daily basis, in my clinic currently as we speak, I see 26 patients, and then I still have to see patients on the ward who come in with poor glycemic control. So I could tell you from the time I started my clinic in the height of COVID, I have moved from 6 patients now to 26. And that number is rising daily because I not only cater to the inpatient population, I cater to the outpatient, which is the entire island of Barbados. And I could tell you the latest statistics says 1 in 5 Barbadians have diabetes. That number has not taken into consideration the ones who are currently undiagnosed, and it might be even more. So as I can tell you, I can't stress the importance of a forum such like this so we can continue to spread the word about how we best can manage a condition such as diabetes.
I know you have to get back to your clinic. I really want to thank you, Nurse Knight, for sharing with us here on the Pulse Radio Show. Your input is so critical, especially for those out there living with diabetes. At least they know that there's an avenue, that there's help, and they can come to the QEH, come and speak to our nurses, and come to the forum and speak to those specialists, speak to the specialist nurses. Those are the ones who can help you, those people living with diabetes, with your condition. You may have friends and family, aunts, uncles, mothers, fathers, living with diabetes, and you want to help them. Let them know there is a diabetes health forum at the Queen Elizabeth Hospital in our main auditorium. That's at 6 p.m. on Wednesday. Be there on time so we can get started and sharing the information. Our specialists will be there. Thank you again, Nurse Knight, for your participation today in our Pulse Radio Show. I'll see you when I get back to the plant.
Thank you so much for having me.
Yeah, I appreciate your time. Nurse Knight working hard all the time. She is one of those who is always in my ear. Shane, we need to get this out there. Shane, we need to get this out there.
That's correct.
And the information is definitely critical as we continue to share how all of this comes together under the 2025 to 2028 strategy. Remember, Dr. the Most Honorable Corey Forde is here with me, the Director of Clinical and Diagnostic Services, and you can call us at 434-1007 or 434-1070. The WhatsApp 434-1007. So you were going into another critical area.
Yes, I was going to area, and it really fits in. Nurse Knight there, my former schoolmate. It's quite funny. And it kind of fits in because the laboratory is the ones who kind of get the results that help make the diagnosis. If you're going to get complications with diabetes, for example, you're going to need your kidney function test and all the other things. But one of the things, if we talk about QEH, for example, and we're continuing on with over the next few years from 2025 onwards, and the targets that we set for ourselves and how we aim to improve things, is one of those specific areas which is probably one of the only places in the laboratory which is not automatically it's automatic in terms of equipment. It's a microbiology lab. I'm very happy to announce that we have been supported through the Ministry of Health and Government and supplying at least 9 to 10 pieces of new equipment which will automate the microbiology laboratory. Now that I can't even express to you as an infectious disease doctor, that is going to be an absolute game changer.
Nice.
For Barbados and probably even for the region once those are in place. And some of those give you an idea of what some of that equipment is and the impact is actually going to have in the hospital. So yes, we have some equipment that is electronic, but we're going to get new pieces of equipment which once we have a positive blood culture, so if you had an infection and something is growing in your blood, then the guys have to go and put it on a plate and look under the microscope and go through a whole set of process and get an identity and put it on a machine. So it's a whole longer process. We're now going to get a piece of equipment. Now once we know that there's a bug in there, it will signal in the machine that there's a bug. We can put it actually in the machine and get our results. It's a large piece of equipment. We can get our results in at least 45 minutes to an hour, so you actually know what bug is growing. That makes my job as the infectious disease doctor easier because I'm now going to be able to target antibiotics correct from the beginning. It's going to impact our country dramatically in terms of you always hear this term out there, antimicrobial resistance.
Yep.
And it's a big thing now in the world.
The Prime Minister has been very big in moving on that. And
right.
I know there's collaboration with some other countries in Africa as we try to get drug stocks available to be able to cover AMR in a big way.
Because it's really a big problem, right? It's a big problem not only in Barbados, it's a big problem globally how we use them. So if we're able to identify bugs faster, then we're able to use the appropriate antibiotics and not just give what we think it might work. We're going to know for sure this is going to be targeted towards that. What it also does as well is improve in our hospital, which is one of the things that we're going to be going into in terms of 2020 from 2025 for the next few years. The program is improving our antimicrobial stewardship within the hospital, and I'll talk about that when I talk a little bit more about pharmacy. Basically getting the right antibiotic on board, getting the right dose on board, and getting the right frequency on board. And that might not mean much to some persons who are listening on, but that's going to be very critical in management. It could actually help with the turnaround time of patients in the hospital, so even cut the length of stay of persons in the hospital, reduce the amount of complications sometimes that can happen from later identification of bugs because the technology might not avail. So I think that the also within that technology that's going to be on the ground, and the plan is I always believe it's important to have the capacity to talk to people on the outside. Some of the new microscopes that are going to come, you're able to take pictures and they can send that to somebody, I don't want to say a country, I almost said the wrong country, to send it somewhere to ask for advice, so they can see what we're actually looking at and comment and be able to guide us if there may be a challenge. So I think we have some game changers coming in the laboratory, and of course we have to compound that with improving the laboratory in terms of human resources.
Indeed. Let's go to the phone lines. We have a caller there waiting. Good morning, caller. Welcome to the Pulse Radio Show, a production of the QEH. What's your comment, question, query?
Good morning. Good morning.
Good morning. Of course, we can hear you clearly.
Hi, Shane. Good morning.
Good morning.
Good morning to Dr.
Forde.
Honorable Forde.
Yes.
One of my favorite people. And Dr. Charles Pierce. Is he in studio with
No,
you?
he's not in studio, but he will
he's
be
not?
at that public health forum that I
Oh.
was speaking about, that 6 p.m. on Wednesday at our QEH auditorium, the main auditorium. Just come into
6
security.
p.m.?
Yes, and security will be able to
Okay.
guide you right there.
Okay, because what I wanted to really ask is how easy it is to have an appointment with him at the hospital, QEH. This is regarding my mom. She's diabetic,
Right.
and she would have had eye screening and so on done at the diabetic screening center in Warrens and stuff like that. So
Okay.
she has enough. Right. So I wanted to know how easy it is to have the appointment for her to see him at the hospital.
Well, let me help you with that.
Please.
You can call 536
Yes.
4800.
Yes.
That's our patient advice and liaison service, better known as PALS, your hospital PAL, or help
536-4800.
536-4800.
Because she has a referral letter.
Right, so they will be able, when I say they, our medical team on the line will be able to
Yeah,
guide you through that process
Mm,
and explain how you can get that appointment
Yeah.
and how they can direct you to Dr. Pierce
Right.
in our ophthalmology department if that is possible.
He
We
would have.
haven't-
He would have seen her
Okay.
stuff before. That's why she would have had the eye screening done at Warrens.
Yeah,
But
and even if it isn't Dr. Pierce, we have a number of specialists, several
Yeah.
specialists in the department who will be able to help Mom,
Yeah.
help her with her appointment and see
Right.
what's going on.
Right. All right. Okay. Thank you. I would call 536-4800. Okay.
Thanks for
You guys
calling.
seem to do a great job. Take care.
Yeah. Thank you, as Dr. Forde said, thanks for calling, because this is how we like to share the information.
Yeah.
A lot of those concerns that come in,
Yeah.
we try to funnel them through that 536-4800, our PALS, our patient advice and liaison service, because it just makes it easier for our patients to understand and navigate the hospital. This morning, the who's acting lead for the service, which is Sophia Williams, she was speaking about the increasing calls that we are seeing and
That's
how
good.
we are managing and navigating that.
And that's good, and I think it just brings back into play the whole patient-centered approach that we're really trying to prevail through the QEH. We know obviously there are some challenges with communication. I always say that I have to be honest. If you're going to fix something, you have to know it's a problem, and I think that these are, like this program in itself, and for people who are calling in, the questions who are asked, this is all going to go a long way towards transcending to get those things in place.
You were on those game changers.
Yeah, so I spoke about the lab, especially in micro with transforming. We know the lab is a very, very hard working group in the hospital, and we have some plant problems in there. I think what I would say is I know that there is support, and I know there's ongoing activity to build a new laboratory, and I know that's in the play, and I know that we're far ahead on that particular point. That's all I would say at this point. And then the other area which I am responsible for is pharmacy, right? So everybody knows pharmacy, everybody uses medications. I will tell people out there, when the doctor gives you your medication, your diabetic medication, your hypertension medication, for example, your antibiotics, for example, and all those other medications, make sure you take them. They don't cost 2 cents, they cost a lot of money. And I think that's one of the other things I need to get across too as well. The pharmacy contributes to a very large budget within the hospital, so we obviously have to learn to maneuver. And I'll tell people that, I think we have to be very realistic as Barbadians and understand the sort of costs. There's a lot of taxes that are paid.
Yeah.
The cost of some of these things are astronomical. When you're talking about for example, the chemotherapy agents or the oncology agent, cancer treating agents, biologic agents, some countries can't even afford them. Some bigger countries than us are challenged at getting them, and some of these are used biosimilars, etc. But either way, these are expensive agents out there, and I don't want people to just discard medications and understand the importance of that. So as we run along into the next couple of years, we're looking at expanding home delivery. We're looking at doing electronic ordering for doctors from the wards, getting rid of some of the paperwork that's there. And I think one of the new and fresh things which I think is going to transform management is we're going to try to we already have approval for a new clinical pharmacology. Hopefully we'll get approval for antimicrobial stewardship pharmacists. But the clinical pharmacy is going to be very important from the perspective that we're going to try to start a clinical pharmacy medical management service, which is going to move the pharmacists from the pharmacy and get them on the wards, rounded with the physicians, giving advice, getting when people are discharged, getting the medications, making sure the medications are gotten to the patients, and getting people move in and out of hospital smoothly, but also look at how we can cut and impact costs within the institution, looking to see if there are expired drugs on the ward, getting them back down to the pharmacy, or near expiration, I should say, near expiration drugs, and getting them cycled in areas where they can use, so that we don't have any wastage in terms of drugs within the facility. So that program, which once we have the clinical pharmacy in place and the new pharmacy posts, which we're given, I think the first time in I don't even know how long the pharmacy got staff. Our new staff proposed, we expect to transform the landscape of management in terms of pharmacological services within the hospital, moving it from just a pharmacist dispensing at the window to moving it with pharmacy interaction with physicians, and that will bring a different dynamics. And for a guy who studied from South Africa all the way across to Canada, US, etc., this is really a new movement, and having the pharmacists having a major impact in patient care, on directly involved with patient care.
Do you ever see a time, because we still see some congestion in that pharmacy area as people turn up for their medication, but do you ever see a time where the medication delivery service would be probably the dominant feature, where people don't come in and have it delivered directly to them?
I would like that to be tomorrow. If you know Dr. Forde very well, he's a grown man. So sometimes I will just walk across and see lots of people out there. I'll even go and stand up out there, and they're like, "Oh, this is the doctor. I know him." I'm like, "Yes. Why are you sitting here? Do you know there's a home delivery service?" And we share out the pamphlets. We give the information. But we also have to understand, as Barbadians, that there's also a culture to that.
Yes.
It's not a culture I really want to happen in the current context, but it's a culture. You have
Granny who lives in what it is.
Yeah, Granny who lives in St. Philip, and Granny who lives in Granny who lives in St. Lucie, and Granny who lives somewhere in Mylars Hill. I don't know why I said Mylars Hill. And that's the only time they're going to get to meet for the month or for the 2 months. So they'll meet up and have a chat and how you're doing and talk as well. But on the same stead, I think that for some of a lot of the younger people sometimes get the medication from the pharmacy for the grandma. It's going to be easy. You have a phone, you have the technology. I think you can make it happen by plugging into that home delivery service as we try to extend that program. I think in terms of also pharmacy, one of the things we're also looking at is how we will integrate the pharmacy and pharmacy services. For example, you may not know, you just think pharmacy is the window, or pharmacies, they write the medication and send it upstairs to the wards, but there's much more that goes on. The people who make drugs, compound drugs, for example, within the pharmacy, for some of these areas. There are people who are responsible just for looking to make sure we get the best choice of drugs as well.
Wow. I mean, listen, I've seen behind the scenes now, coming from my time here at the Caribbean Broadcasting Corporation and making my way over to the QEH, I see behind the scenes, and I see how much work goes into, especially in the pharmacy. The pharmacists
in a small space.
So it would be good when they can get some expansion, that they can do more. And as you said, with those new posts coming into the system, a lot more can happen.
Yeah.
And more people on the medication delivery service means less people in hospital, less congestion, a freer hospital, and we know as a man,
less paper based. Because to me, electronic ordering will have to be, one of the major things that will cut down some of the work. People moving paper from one place to another and cost. Yeah.
Let's go back to the phone lines. I have something else to mention to you because you're an infection disease and control specialist. So this decongestion of the hospital speaks well to keeping those types of things out of the hospital space. Good morning, caller. Welcome to the Pulse Radio Show, a production of the QEH. What's your question, comment, query?
Peace be unto each and every one. A blessed and a spirit-filled week to you all. Glad to hear.
We love that.
Again, I'm blessed to hear Dr. Forde's voice.
Blessings.
I just want to say a special thanks to a few people. Dr. Don Grosvenor, who I have two grandchildren, who physically impaired. Visually impaired, so they get so nervous, visually impaired, and she's such a wonderful doctor. She and the others there in the clinic. And there's a gentleman who go beyond the call of duty, Mr. Who take, because I attend the hospital too, who take the bloods, and he go beyond the call of duty and make sure that those persons who have to go to work will be able to go to work on mornings that they have to get bloods done. And I salute that gentleman so much. I don't know if he's still at work or if he's gone home.
No, he hasn't gone home yet. But ma'am, I just want to not to interrupt you, but I really have to say this, and I really want to join your sentiments for all of those who work across the street in phlebotomy. And you shouted out Mr. Hope and congratulated him. I will tell you, a couple of months ago, through the director, he was one that was awarded the Employee of the Month for exactly what you've just said.
I gave him something too. I went overseas and I got a plaque made where I was, and I couldn't do it because there was COVID, but after COVID I did. And I was getting medication in COVID time. The medication was coming home to me too, so let people know that it didn't now start. It started a good while around COVID, and I was getting my medication from the hospital. Yeah. And Dr. Forde, you and all the others, I am somewhere where father figure is suffering stage 4 cancer, pancreatic cancer. And I know how expensive it is because some of the medication ain't coming from the hospital. He have to get it sometimes pharmacy or from overseas. And my heart goes out to those persons who can't afford. And I would like, before I die, to see an MRI machine at the hospital because I almost had cancer. When I come back home, I have to check to see if everything out. And thanks to my doctors there and outpatient Dr. Bernstein and my daughter, I can't remember his name now, but he know who he is, and all the other doctors there that looked after me. Yeah. So I would like to see an MRI machine at the hospital because even if you have to pay, you don't have to pay that amount.
Well, you don't run yet. We got good news for you. We have good news for you on that MRI. I just gotta talk. She can't hear me. I just want to talk to you about the MRI. It's one of the things that has been already approved at board level for the institution to invest in an MRI. I didn't say that before. I was saving that for later, but I'm thankful that you called so I can say no. So one of the things that we're going to be getting down the line is an MRI for sure. I'm sure that would be good news for you. I just wanted to kind of stick a pin there in terms of talking a little bit about the chemotherapeutic agents. We know they're expensive. But I can tell you the hospital, we go all out as best as possible to try to source some of them. Sometimes it's difficult to source in the current world. I can tell you from coming and working in some of the other countries that are even much more wealthier than us, people don't have access to some of these agents. So I am every day thankful that we have the capacity in this country to have access to many of these agents, and some of them are life-changing for individuals. At the same state, I'm very sorry about what has happened to the members of your family, but I'll use the opportunity here to encourage Barbadians to continue to do screening, whether it be for prostate, whether it be colon evaluations, and have regular checkups with your doctor. I always tell people I'm getting younger, And so now I have to start with my checkups. When it was 20 years ago, not that long ago, but 15 or 10 years ago, it's like nothing will bother me. But we're seeing illnesses and these diseases coming on earlier and earlier. And as they're coming on, we are also improving our diagnostics within the institution to try to identify them early, right? If you talk about breast cancer, for example, is another big one where we're now going to be putting a brain back mammography into the hospital in a great set. Again, another major improvement over the next few years with the CapEx budget that's coming. Again, that's going to change the trajectory of where we are. But we're going to bring this new equipment, but you also need you, as Barbadians, to follow the triangle and finish the triangle by getting tested and getting screened, so that we don't end up with some of the tragic events that sometimes that we
Hello?
hear.
Yes. Mm-hmm.
Hello?
Hi.
I lost my mom, my sister, my stepfather, and a lot of my family and my close friends through cancer. Oh,
Yeah, I'm very sorry.
I know how
Our
it is.
condolences.
But I just want to say thanks to my doctor. I love that gentleman to my heart, and I always keeping him in my prayers, Dr. Gill. Oh, thank you all very much. And Dr. Forde, I'm so happy to hear you when I heard this morning that you would have been on. I'm not in Barbados, but I made sure that I spend my money just to talk to you.
Serious. I love you too. On national radio, I love you too.
All right, God bless you all and stay safe, and God bless Barbados. And I would love to see the Queen Elizabeth back to where it used to be the shining light. It used to be the shining light of the Caribbean, and I would love to see it again. I don't know where you all will move it, but because we have to get a new one. But I hope we will go back up to standard, and where cancer and diabetes and those things is, I feel that there should be the forefront. And a healthy people, a healthy nation is a prosperous country.
That's
so
right.
we have to do our best. It's a pleasure speaking to you all. God bless you all, and I'll be home soon. Or as the song says, I'll be home for Christmas.
Well, whatever you do, get home safe. We're happy to hear that your doctor is making sure, Dr. Gill is making sure that you are in good stead. You sound like you're in good spirit, so get back home soon. We'll wait to hear from you as we continue here on the Pulse Radio Show.
Friend, I'm here because of my friend with the cancer. I came down to assist because I know how it is when you are sick and you need all the help you can. So I came to assist.
All right. Thank you very much. Thanks for sharing, and thanks for calling from wherever you are in the world on today's edition of the Pulse Radio Show. As I always tease Dr. Forde and tell him I know he has a humongous fan base for all the work that he has done through COVID and otherwise. So he's well loved in the population, and rightly so, because he's saved many lives, and he's given us some critical information that we can use for better health. You're listening to the Pulse Radio Show, a production of the QEH, also sponsored by our partners. We'll take a break here and get back to more with Dr. Forde on the Pulse Radio Show.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
A big thank you to our partners, MedSafe Medical Supplies, for making this Pulse Radio Show a reality on Q100.7 FM. They supported us in Season 1. They decided, you know what, We think this is important for the public, so we're supporting you in season 2. So a big thanks to Rohit and the team there at MedSafe Medical Supplies. Also, they have another segment of the business that I'll tell you a bit about later on, where you can get all of your supplements from the Fit Stop. The Fit Stop, so like those protein powders and other things you can get from the All Your Health supplements. So you can check it out. It's on Instagram and Facebook, and I'll give you a phone number shortly. We've been speaking about the 2025 strategy. We've been speaking about diabetes. We've been speaking about the Health Forum, which is on Wednesday at 6 p.m. Someone did ask if it is being streamed. We're trying to sort that out, but we're trying to get people to come into the auditorium at the QEH, and we'll also try as best as we can. That was not the initial plan to get it streamed, because we wanted to have that face-to-face with our consultants. But if it is being streamed, I will definitely get that information to you over the next couple days, as in tomorrow. So over the next 24 hours or so. Let's go to the phone lines very quickly. We do have another caller. Welcome to the Pulse Radio Show.
Good morning, sir.
Good morning. How are you doing?
Can I speak to Dr. Forde, please?
He's here listening to you. He's on the line.
Good morning,
Dr.
sir.
Forde?
Good morning, sir.
Good morning. You know who is this?
No, I don't.
You know this voice good enough. This is Ralph Lewis, man.
Okay, sir. Ralph Lewis. Yes.
Huh?
Yes. Thanks for calling in, sir.
You know who the person is now?
Of course I do.
One of your old-time patients, my brother.
Yes.
Oh, you keeping your good self, man?
Yes, I'm fine, sir.
Man, I tell you, struggling, you know.
Okay.
Oh dear, man. I'm so sorry that I had to move around from you.
Mr. Lewis, see if you can silence the radio in the background so that you can better talk to Dr. Forde and get your concerns and queries answered.
I'm so far from the radio. Does it?
I can hear it in the background though.
Come here a minute, please. Oh yes, I called the madam to the off the radio.
Alright, that's no problem. But you can still ask your question in the interim. Or make your comment.
Yeah, I always will make a beautiful comment about Dr. Forde.
Yeah.
Turn off the radio, get down to Dr. Forde.
As I said, he's well loved. He is definitely well loved. So talk to Dr. Forde.
Yeah, so
Yes,
I'm gonna prove to you I remember very much about it. I'm gonna ask you 2 questions if you allow me to.
I would.
Yes. How are you doing? I think one of the departments in the hospital I'm responsible for is physiotherapy and rehabilitation. And that's a very important part. There are many Barbadians out there who do, unfortunately, get events. Strokes,
they give me my papers, send me out of the physiotherapy. So I'm home.
You're home, and you're coping on your own. So I think that's one of the things that we will see an improvement of in the institution in the near future, in terms of rehabilitation. And the restructuring and building the expansion of rehabilitation for the institution.
No, I'm still suffering with the pain.
Yes.
Still suffering with the pain in the hip.
Oh boy.
That I got.
Oh boy. So we got to get you some vigorous. I will call you offline. When I'm finished the program, I will give you a buzz online and try to deal with those medical issues. Yes? I will give you a buzz.
That very much.
It's very good hearing you.
You have his number, Dr. Forde. You can get it left to the producer.
I have his number. I am like that with my patients. I have his number. He knows I know how to find him.
That's right. Yeah, you know where to find me.
Yeah.
Well, thank you so much for calling the Pulse Radio Show. Just to hear Dr. Forde, we appreciate your support, and Dr. Forde will make sure that you feel better soon.
Thank you very much, sir. Too.
Okay. Yeah, thanks for calling.
Take care. Take care.
Have a pleasant afternoon.
Okay. Bye.
Bye.
Enjoy your lunch.
We will. Dr. Forde, you were getting into some of the other tenets of the strategy.
So it's interesting that Mr. Lewis calls here, because one of the improvement strategies 2025 going on 28 is we're looking, we've recently gotten one of the best CT scan machines in the island, 128 slice CT. Now we have 2, which is the second one that's going to emergency department, but we still had one that was donated by a kind group during COVID. And that's still in use. So, sometimes you may get something in your throw away the old one. We're not about that. We're about expanding services. And with that, we're going to have an expanded staffing as well. I think that's going to be crucial. It's okay to bring in new equipment, but I know that, the need require people you can't be using the same resources.
And on both the medical side and the engineering side as well,
yes,
for maintenance.
And the diagnostic side, so somebody to read that. So we'll be getting new staff to do that, new consultant staff, new ground staff to do that. We're getting new ultrassonographers to help in terms of ultrasonography, but in terms of scans and imaging, I think that particular scan was a game player. Of course, I believe in the future we'll even do better than that, and allow us to do a little bit more in terms of what critical things like CT, coronary angiography, which if you don't know what that means, if you have getting chest pain and stuff, the guys can look, do some imaging and see if you have any blockages anywhere. So those are things that we expect to improve. But what I'm going to say in terms of 2025 going forward is that we're going to, in very short stead, open up a different leg of the radiology department within the emergency department. That is going to be a game changer for managing things such as, for example, with all the protocols in place, of course, of managing things like strokes, and managing them quickly, and trying to prevent some of the complications that might have happened with strokes, as happened to one of the callers here. That's going to be a big game changer. What it's also going to do, we recognize and look at data. I'm a man who I like data, as you know, the epidemiologic leg, and I use the data to make differences or changes. And one of the things we recognize is about 60 or so % of the studies in the hospital are through A&E. So if we divert, it means that some of the imaging in the outpatient setting, inpatient setting, for example, whether it be inpatients from our clinic or from polyclinic, probably going to get things done even a bit faster.
And I know that's what the public wants to hear.
So you're going to really get that reduction in time. Is about 36 or so % of the studies done upstairs from the outpatient setting, so that's if we put those numbers together, then that's really going to be transformative for the institution over the next 3 years. I think that's important to mention, with the addition of mammography back into QEH.
Yeah, I want to ask you about the MRI machine as well. Let's go to the phone lines very quickly. We have a few more minutes here on the Pulse Radio Show. Welcome to the show. What's your question or comment, caller?
Yeah, pleasant good morning to you.
Pleasant good morning. Good morning.
And how are you today?
I'm all right. I'm good, actually.
It's good to hear.
Full of energy.
Me too. Good day, Dr. Forde.
Good morning to you.
It's a pleasure having you in also too.
Yes.
But please. I could let this section go with physiotherapy and not calling to see my son go to physiotherapy at the hospital too, and I have come to a relationship with Dr. Hood. So he's become like a son to me now.
Wow.
I want to salute Dr. Hood for his timely work he does at the hospital and in looking out for his patients and so on. He's a very warm and loving person.
Yeah. So
and I must say thanks and kudos to him for how he looks out for his patients. Not only for my son, but for others. I can feel his love coming through. I'm visiting in prayer, so I can still feel the love from Dr. Hood coming through.
Yes, and I will relay that to the team. Another large, sometimes these are the heroes without capes within the institution, and they're downstairs away from everybody else. You're talking about rehabilitation. You're talking about prosthetics, orthotics. The people who fit people who may have lost a leg for some reason, have a diabetic foot and had an amputation, for example. You're talking about the guys from rehab who are dealing with people with strokes, and the one doctor down there, Dr. Harley Mosley III, who runs the department, Dr. Jerry Warner, who runs the physio division. So I think these are the unsung heroes institutions. It really thrills my heart, to be honest, this morning when I hear people call in and speak about these good experiences
and calling the doctors by name.
They're calling the doctors by name, which means you have a relationship. And I think that's important. Sometimes we hear negative stuff, and I think as a country, as a countryman, as a guy who believes in improving things in many states, I think we as a nation need to do exactly what you've just done, to call in and talk about those good experiences, highlight some of the good aspects with our institution. It is the only place really for some people to go to when they get ill. So this is why I always say it's important for us to acknowledge when we have challenges, but fix them and get them right. And when we get them right, we're happy to have people like you come call in and salute the institution for its good work and the employees on the ground. Saluting you today, Dwayne Hood. I believe that's his first name.
Yes, that's what I mean, Dwayne Hood.
I know everybody who works. I know all of their names.
From the time you step at the door, you can tell, you can feel the love, even from the receptionist and so on.
Yeah.
As soon as you get to the door, they greet you very well.
Yes.
So I want to say thanks to them. But my other partner, another question for you.
Mm-hmm.
If I had to go to an outpatient clinic, say on a Tuesday, and when I got to the clinic, I was told, someone said to me, don't go out no further up because the clinic is closed. But no one had indicated that the clinic would be closed.
Mm-hmm.
So therefore that appointment would have been out.
Mm-hmm.
Should I be sent then to get a new appointment and sent then to be coming back in March? For October?
So I think it's unfortunate.
But it's not my fault that the clinic, it's not my fault that they didn't come. I turn up.
I know you did, and I'm sure you probably came from a long way too. Who knows? But apologize for that has happened. What I'm going to advise you to do is to contact our PAL system and let
536-4800. You contact that number so that
I know the numbers.
I'm glad you know it. So
I know the number there. I know the number for the hospital. I know the number for the hotline delivery, the pharmacy delivery. Persons even call me to get numbers for the hospital.
So let me ask you a question then. What's the number for the medication delivery service? Let me see if you really know it.
536-4804.
Oh jeez, Alfred, you're on the ball. You on the ball.
I go find a job for you in the hospital.
I'll be walking directory.
Alright, so let me hear you now. The hospital PBX
436-6450.
we can't win you at all.
Stop testing me.
You know my number?
I'm gonna get that soon.
Listen, are you coming to the Health Forum on Wednesday at 6 p.m. in the QEH auditorium?
You want to come and get me?
Because I could come and pick you. I can send if you want. Come and pick you up. Come and do that for you. But you come and you bring a friend, okay?
All right, hear you.
Okay.
I will try.
Yeah, we look forward to seeing you. Come down.
Have a wonderful day and thanks very much.
All right. Thank you very much. Time flies so fast on this radio show, Forde, and my condolences to your family. I know you have to attend a family funeral right after this, so really thank you for accommodating the team on the radio show today. Your final thoughts as we look to advance your directorate under the strategy.
My final thoughts really land around this. I think as we move forward as an institution from 2025 to 2028, you're seeing many things happen and many wheels are turning, and we have to work together in an institution. It's not just my directorate. It's all the directors need to work together, whether it be finance, whether it be information technology, whether it be engineering, because they all impact each other. And then ultimately that's towards the improvement of patient care within the system, and also finally to impacting patient care for the everyday Barbadians who can't afford to go to do something private. I want to tell all the listeners out there to have a good day. Continue to support the QEH, to support the institution. Let's make this continue to be the Mecca of the Caribbean.
Indeed, with all of the new equipment, the MRI machine, the mammography machine, and of course the CT scanner coming into accident and emergency, and then with all of that, the linear accelerator, which will be a critical component in the oncology department for treatment. We will continue to raise the bar at the QEH. I know it can be difficult sometimes, but continue to call us here on the radio show and share your experiences with us. We want to be here for you. We thank you for being a part of the radio show today. I'm Shane Seeley, Communications Specialist, alongside Dr. the Most Honorable Corey Forde, our Director of Clinical and Diagnostic Services, and of course our COVID champion during the pandemic. We will see you next week with another great episode, more information, more details, and more from the QEH right here on the Pulse Radio Show. I'm Shane Seeley. Goodbye for now.
Thank you very much, Shane. The Pulse Radio Show was brought to you with the compliments of MedSafe Medical Supplies Limited.
I am a
Barbados. For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.